Brin. Welcome back to the Morning Blend, where we're transforming your health with Columbia St. Mary's, part of Ascension. Well, almost every 40 seconds, someone in the U.S. has a stroke. And while most people know it's important to call 911, not everyone knows the warning signs. So joining me today with an important message about strokes is Dr. Michael Brin from Emergency Medicine at Columbia St. Mary's, Ozaukee Campus. Thanks for being here.
Thank you so much for having me.
We were chatting during the break how important I think this is. I think, you know, a stroke, just hearing those numbers, being with family over the holidays, I think we have to be confident to know the signs and the symptoms and know how to act. So let's first kind of define what a stroke is, because I think a lot of people get confused between stroke, heart attack, other symptoms.
Sure, and the basics of a stroke is loss of blood flow to part of the brain, and typically it's from a blood clot. More than 80%, if not 80 to 90% of strokes are from a blood clot or some blockage of flow of blood to the brain. A small percentage are because of an artery ruptures, and the blood just doesn't get to the brain, and the brain tissue can't function and do what it's supposed to do.
And these are probably blood clots that people don't always know they have, right?
Correct.
So they're not monitoring or on a blood clot medication.
Correct. And it can happen just in a split second. It could be something that's been building up that you just don't realize, you don't notice, like most things in our body.
Yeah, absolutely. The one important thing and why it's so important to recognize signs and symptoms is the timing, right?
Absolutely. And I think, you know, we've done a good job of getting out that if you're having a heart attack, timing is of the essence. And stroke, the message is starting to get out there, but the more we get it out, the more we understand that timing is so important, because if you lose blood flow to any part of your body, especially the brain, that brain can't function, and the longer it goes on, you can lose function completely, and it might not come back. So the sooner you get in, the sooner you can recognize it, the better chance you have that we can do something about it and reverse it.
Are there numbers associated, like this many minutes or this long of a time before you've got serious damage?
You can start doing damage within 20 to 30 minutes.
Okay.
So it's of essence, but the real importance is that you get into the emergency department within about 4.5 hours.
Okay.
That's actually a really key number, because if you can get in and I could do my workup, I can actually give you a medication, or we can intervene to try to break up that clot.
Yeah.
And the sooner we can break that clot up, the sooner we can restore blood flow to that part of the brain. If we do that, we can get you back to normal.
I think that's going to give people some relief. And what's important with that is to recognize the signs and symptoms, because if you don't know the signs and symptoms, you're eating into that time. So let's go through some of the signs, the symptoms, because there's an easy acronym that people can learn and remember, and the word is FAST. And the acronym, these are the sudden signs of a stroke.
Absolutely, and it's really important because stroke can affect almost anything we do, but the most common symptoms that come with stroke are in one part of the brain, and FAST is perfect for it. F is for face. If you notice somebody with a facial droop, one side of their face just kind of isn't working. An easy way to see if you drink a little bit of water, or someone's drinking, and all of a sudden it's just coming right down that side of the face, because they can't use that part of the face. It's really it's quite disturbing for the patient or for somebody watching. A is for arm. Now, for this, it can be kind of tricky. So it's weakness in one arm versus the other.
Okay.
Now, sometimes it can be subtle. So what I always have patients do, or family members, is I tell the patient to close their eye, so they can't kind of watch that other arm, and you just watch that other arm drift away, or see if it's weaker than the other.
So they're trying to hold them out like this with their eyes closed, and they won't even notice that one arm is kind of going down.
Correct. It's because the brain can't function and keep that arm up with the strength.
That's great. I hadn't heard that before.
Yeah. S is for speech. You know, some people speak a little clearer than others, but when someone has slurred, garbled speech, or just not speaking correctly. If you ask me a question, you say, hey, how's the weather today? And I'm saying, you know, black car. It doesn't make sense. That could be a sign of a stroke.
Okay.
Slurring speech is also the sign of a stroke. So S is for speech, and T is time. And again, we can't impress this enough. The time is of the essence. Getting in as fast as you can, as quickly as you can, will help us take care of you better.
I think that's so easy. I know the symptoms are not always cut and dry, and sometimes the symptoms can be weak, as you said, or light, but there are other symptoms that you can know beyond FAST, and those are important as well. Things like sudden numbness or weakness of the leg or other parts of the body. Is it always only on one side? It's
typically going to be one side versus the other. So if you have, you feel weak or numb on your right arm and the left arm, it's kind of the same. Probably not a stroke.
Okay.
If it's the right arm, left leg, again, probably not a stroke.
Okay, so it's going to be one side of the body.
Typically, and and with all of these, there's other symptoms like dizziness, confusion, just not acting like yourself. And sometimes it's not easy for you to pick up. Sometimes, especially the holiday time, as we were talking about, it's easy for somebody to see that in you. So having being able to recognize those symptoms, even though it's not, the face or speech or maybe an arm weakness, but maybe, hey, you're just a little off balance, you're leaning over towards the right. Those are really important to recognize as well.
Okay, and I think, what I hear from you saying, some of these other symptoms, the numbness, confusion, trouble seeing, dizziness, severe headache, those could be confused with a migraine.
Absolutely.
So I think it's better to probably err on the side of caution, is what your message really is.
Absolutely. I mean, that's why I drink a pot of coffee before I go into work, so I'm ready for this no matter what time you come in. And it's really the truth, because the symptoms can be scary. You know your body best. I can read the textbooks, I can go over the research, but you as an individual know your body best. So if something doesn't feel right, that's why you get in. Could it be a migraine headache? Absolutely. Could it be Bell's palsy? Absolutely.
Okay.
Could it be, just something in the neck that's causing some weakness in your arm? Absolutely, 100%.
But get it checked out.
Get it checked out, because if you don't, and it's 24, 48 hours later it's lingering, you're going to regret that you didn't.
I think that's the best message that you can send. Columbia-stmarys.org is where you can find Dr. Brin, other doctors as well. To learn more about their accredited stroke care, visit that website as well.